supporting the enhancement of wages, and educating providers on insurance options and other resources that the state has to offer. We expanded eligibility for Child Care Assistance Program and launched a pilot program making all child care workers eligible for it, and changed the required adult-to-child staffing ratios at child care facilities. We've provided Child Care Challenge grants to communities based on projects that increase local child care options, and we established a business incentive grant to encourage employers to incorporate child care benefits into their total compensation package for their workforce. And we're here today to launch one of the final remaining recommendations from the task force. It is a central online hub for working parents that can quickly and easily find child care providers that are near them, that have openings available now, and so much more. This new resource for parents would not have been possible without the state's implementation of a shared service platform for licensed child care providers, and that again was another recommendation by the Child Care Task Force. Today, the child care management system supports approximately 3,500 providers with their business operations, allowing them to automate key functions like enrollment, waitlisting, payments, and payroll. And now it's also one of the several data sources for the state's new Iowa Child Care Connect website. This is an online tool that's going to fundamentally change how Iowa's working parents find child care. In fact, Iowa Child Care Connect integrates statewide child care information that really has never been aggregated or come together in one place before. To our knowledge, we believe Iowa is the first state in the nation to integrate and display near real-time child care data from multiple sources in this way, while also improving our child care system statewide. It's a convenient tool that will help working parents navigate their child care decisions faster and easier than ever has been possible. For parents that are searching for options, the site can map locations of centers along their route from home to work and identify those with immediate availability or wait list. It can also provide a side-by-side comparison of multiple providers. But perhaps just as important is the business intelligence that it provides. This tool will allow the state to pinpoint exactly where and why child care access is limited in parts of Iowa. And that will allow our teams to be able to apply data-driven decisions to identify solutions. So here to give an overview of the site's capabilities is HHS Director Kelly Garcia.
Good morning. Thank you, Governor, and thank you so much for your unwavering leadership and commitment to working Iowans on this issue. It's incredibly important. I really couldn't be more excited about today's launch and what we're unveiling today, and I know firsthand exactly the type of tool that it means for working parents and caregivers to have something to access that is just this easy and comprehensive, as you mentioned, Governor. When I moved to Iowa almost 5 years ago, which is hard to imagine that it's been almost 5 years, my children were 18 months and 4 years of age. And we were leaving a provider in Austin, Texas, that I was on a wait list for nearly in my entire pregnancy to get into. And it met all of our needs. It was right on the pathway to work. It met our family's needs in terms of the curriculum we wanted to see. It was quality. And it gave them the socialization that I was looking for as a working parent. When we were planning our move, I struggled to find easily accessible locations here in the Des Moines area, despite having access to the very people that oversee this work every day. It wasn't readily available, but it will be now. This tool is born out of those frustrations, brought together by a number of leaders that the governor convened years ago, and it's now coming to a reality. In the last few years, as Governor Reynolds mentioned, we knew we could do better. We've infused millions of dollars into child care in the state. We're really leading the nation in that space. These dollars have expanded child care slots. They've increased child care workers' pay. They've eased unnecessary regulations and red tape that prevented childcare providers from expanding, but we are absolutely not done. Today, we introduce to you a first in the nation kind of way to show access to childcare openings across the state, to drill down, as the governor mentioned, into spaces that give parents easy access to the type of childcare that suits their family's needs. And it can even access your route to work, which might be different than the area that you live in. This invaluable and incredible feature will help parents, grandparents, and other caregivers identify and make connections where childcare openings are, no matter where they live in Iowa, and it is refreshed daily, so it is nearly in real time. Our goal is to reduce any barriers and challenges that parents and caregivers may have when they're trying to find childcare. Too many parents can attest during those COVID days that childcare is absolutely a necessity. It gets people to work, but not just for them, but for the livelihood and development of their own children. Childcare is protective in nature, and it's an essential service for working parents. We don't want parents or grandparents and caregivers to be sidelined from work because they can't find available options for childcare. This new search does just that. It connects you to the latest childcare openings anywhere across the state. And not only does it allow you to search for openings, but it allows you to dig really deep into quality ratings through our Iowa Quality for Kids rating system, which we call IQ4K. The second part of this tool, as the governor mentioned, is the data that will be accessible to others, and we know our governor loves data. It will be publicly available dashboards that will be displaying these feeds and more that will be launched at, of course, a core function for parents and caregivers, but think about the data points that it can give decision makers. And when I say decision makers, obviously it's the folks up here in the room who are thinking about funding and support for our child care centers and home centers across the state, but also think about local officials who want to invest in their own communities, business owners, and human resource directors who are thinking about those really important tools to recruit folks into their Iowa communities. This information is an incredibly powerful tool. This data will help give all levels of government and other decision makers areas where they can really invest in their communities, where they can expand and grow because they're experiencing high volume or a shortage. It will be targeted. The power of this data is incredibly valuable to all involved, and again, nearly real time, which allows us to make decisions today, but probably more importantly, allows us to invest for our future. We at Iowa HHS pride ourselves on partnerships, and we've built and maintained across all sectors of government and with the private sector. And together we want to better the lives of all Iowans, and we can do that by collaborating on initiatives just like this. So I want to thank our team. Our team is, of course, Ryan Page and her incredible childcare team, but also our partnerships across Iowa State University and Resultant, which is our data and technology firm that helped us build this site. They are the brains behind this collectively, that team of three, and this collaborative partnership couldn't be a better example of that public-private partnership in Iowa government today. And now Ryan Page is going to give a demo of the site.
Good morning. Thank you so much for being here and giving us the opportunity to share our child care search function. Thank you, Governor Reynolds, Director Garcia, for the ongoing support for this work. So when we are at the Iowa Child Care Connect webpage, you've got three different opportunities here. One is the child care search that I'm going to focus on today. The other two are dashboards that Director Garcia was talking about as it relates to being able to make data-driven decisions at the local and state levels. So when you click on the child care search, we're going to have an opportunity to do things a couple of different ways. First, we can do along my route. So I'm looking where I live. Perhaps I want to add a destination in the middle of that. So if I have to drop a child off at elementary school before I'm going to childcare, I can go ahead and add destinations to that route. So the first search here, I just put something near Clive Public Library and then going to the Lucas Building down here on the Capitol Complex where my office is going to be soon. So if I am looking for childcare, this looks very overwhelming. The green are childcare facilities that indicate that they have an opening right now. The red are those that are saying they do not have any openings. However, if I want to look and drill down and say I'm specifically looking for a 3-year-old, not a whole lot changes. But perhaps I'm only looking for a licensed child care center. It starts getting less. I also have the opportunity to decide how far off of my route am I willing to go to find the child care that I am looking for. Child care assistance, these are programs that accept child care subsidy or don't. Our Iowa Quality for Kids, our voluntary quality rating system, we have the opportunity to drill down there as well. If I want to look at specific information about a child care program, and this is being a little funny, so sorry about that, I can see here they accept child care assistance. They are not currently rated. I can see what numbers of children they identify that they have available. I also have the opportunity to go click on this link and go to the compliance and complaint reports that HHS has as a consumer opportunity to learn about the child care provider themselves and where they are strong and where they may have some deficiencies. If I am a child care provider and I see that I am red and I say I have openings available, I can click on this button in real time and change that information. That will go through our child care resource and referral database and upload with the next change. I may also add programs to my favorites. And when I go to my favorites, I can get a side-by-side of these programs. You'll see that these are blue. This is mobile friendly. I have the opportunity on my phone to click, make a phone call, do an email, find out more information. We've got days and hours of operation, whether or not there's transportation nearby or they offer transportation, and their available openings. The second way that we can do a search is strictly by address. So if I want to find specific information at this location, you'll see it's not as big as Des Moines. There's not as many options available. However, in where my address is, I can identify the number of childcare facilities that meet my search requirements. Anything in green, as I said, that is where they meet what I'm looking for. If you see a gray, there are some of these. Those are primarily programs that are restricted to general public. So some businesses may offer childcare programming specifically for their employees. Those are the ones that are going to be gray because they are not reporting any public-facing slots available. The last option when we're searching is through a guided search. So I can be looking for childcare today that I need tomorrow. I also may be in the planning stages of my family. And so when you see 3,210 childcare providers currently, that is our state number. And that means that's what's available for when I'm planning in the future. If I'm planning for now, it does go down to 993. So when I'm planning for later, I can say I'm looking for an infant. Yes, I am interested in quality rating. I don't need childcare assistance, perhaps. Those are working hours that work for me. I'm looking for a childcare center. And then I can go and do the along the route, and it takes you back to something like this. So this is, again, near real-time data. We have multiple data sources that are feeding this so that we have up-to-date and accurate information for our families. Thank you.
It's been a while since I've seen it, so I'm just all excited all over again to see just all that it has to offer. I mean, it's just really impressive. So thanks, Kelly, and thanks, Ryan. just appreciate both of you and your team, and really, as Kelly indicated, the partners at Iowa State and Resultant. They put a lot of time and effort into this project, and I think that's reflected in it. I'm so grateful to everyone who's worked together to strengthen and grow Iowa's child care system. As Director Garcia said, we've made great strides, but we still have a lot of work left to do, and we know that, so we're not going to pause or rest. We're going to continue to really identify where the deserts are at, look at opportunities to continue to build that out. We're really driving public-private partnerships, and we're seeing some great examples in that across the state of Iowa, so that can maybe hopefully be a plug and play. There's a couple up in Dubuque and really across the state, so we're really seeing some great things. Businesses are really stepping in and being a part of the solution as well, so I love where it's going. So if you're looking for childcare or you know someone who is, go to childcareconnect.iowa.gov and find options available to you. And so with that, I think we'll be happy to answer questions on topic, and then we'll open it up for everything else.
I'm just curious how it's real time. I mean, the state has tried to do this with available psych beds and has not had success.
Well, Kelly can probably go into more details, but it's that shared platform, I think, is a big component of it. To really, and I think how many providers did I say we have on that? Like 3,500. So that data is feeding into the system. Do you have anything to add to that, Kelly?
I think the only other thing I would say, Kay, is that we have different data points that are coming in through our agency because we also regulate childcare. So it's a bit of a different vantage point. We're dealing with a more fulsome set of data points, although we have that bed tracking data as well on the hospital side too.
Yay. Thank you. So we're getting better. Technology is getting easier. We're understanding how to use it. But just that childcare platform that I'm talking about, that brought technology to so many providers that were doing that by hand. They were doing that through an Excel spreadsheet. So just connecting the dots and really using that data and making it accessible, it helps everybody. We're getting better all the time, and our systems are getting better.
Governor Reynolds, you said the dashboard would allow you to better understand where and why childcare access is limited. So at this moment, can you tell us where and why childcare
No,
access
well, no,
is
but that's not a snapshot. That's an ongoing process.
Sure.
But now I have data that I can do that. So when we're sitting down and we're talking about what does the next steps look like for childcare, we can look at maybe some pinpoints across the state. We can get a statewide view advantage of maybe there's not enough slots for babies. How do we drive that? Maybe there's people, we have more in-home, but we need more different facilities. It will help us drive that. And it will really help us. I can pick an area and you can see how many are available. That'll help us identify where the deserts are at. And then we can intentionally maybe go into those communities, make sure, sometimes just in rural Iowa, it's hard, as hard as we try, to understand all the programs that are available. So just to intentionally sit down with the community, with the businesses, and talk about, this is a recruiting tool for you. This is an investment that you should be looking at as a community, because if you can bring workforce and talk to them about available childcare, that's a game changer when you're trying to grow businesses or try to get new businesses to locate in the state. We didn't have this before, so and then we'll learn as we continue to use it and continue to build it out. Maybe what are some things that we're missing that we can maybe pull in and have that be a part of the conversation. But I do love data. It helps me make informed decisions. What I found in my tenure as governor is we collect a lot of data, but it's siloed. We're not able to aggregate it and really make informed decisions. So we are getting better at that. Realigning government was a huge step in the right direction. Aligning all licensing in one agency, huge step in the right direction. It actually makes it more manageable to collect that data, aggregate that data, and actually use it to really define what we need to do going forward.
Will this additional data give you ideas for affordability? This seems like this could be kind of a time saver and stuff for families, but affordability is still a big issue, obviously.
It's part of it, and I assume they're checking that out when they're doing I'm looking at Kelly every time, they've done the ones when they're doing the side by side. So if I'm missing something, both of you step right up here and address it. But yeah, but a lot of the things that I ticked off that we've done, that Director Garcia talked about, starts to address some of those things too. you got to be careful. I mean, it increased cost to the family, so we're talking about affordable, but we also need workforce. We need to be able to pay them a living wage too, so that's a component of this process. We're doing, as far as workforce, we're working with the Department of Education and doing some unique early childhood programs in our schools, and then they're able to, those students are able to actually work at the child care facilities that are local. Really helps them decide if this is something that they want to go into to get a start. So again, it's those kind of partnerships that are helping. I think increasing the eligibility for the child care assistance program has also helped with some of that.
On that, are rates a part of the information that they'll get when they look up a child care center?
It's probably not on it, but it's not on it, but they have a phone number to call in, and you can do that right from. So that's what I'm going to check, as I would a long time ago, you know. But
So Governor, for existing child care providers, do they need to do anything different to be included in this, or is this coming from information they've already provided
Ryan, do you
to
wanna-
the state? Just kind of walk me through that process,
Yep.
and then how can we be sure that it's comprehensive? For instance, could there be providers out there that you don't have data on?
Well, and that'll be part of we're just launching it, but I'll let Ryan.
Yeah, those are great questions. So as I had mentioned earlier, and I'm not gonna mess with it, there was a button on there that said CCR in our database. So that's the first point that I want childcare providers to go to when they see this, is if they do not believe that their information is accurate, they can go into that system and use that. Anybody that's using that child care management system, that is real-time information that is data dumping into this system. And then we also have a survey mechanism for our child care providers that we're requesting from them regularly. So anyone that's not currently participating, we certainly want them to be participating. Hopefully this can engage providers with those child care management systems, as well as we get the number of providers actively participating in this increasing.
It's a marketing tool for them.
Absolutely.
I mean, it's a huge advantage for them to be on the site to market their facility.
So, as a parent who's actually currently looking for childcare, I love this.
I'm looking at my team over here too. They're all, yeah.
I'm using the site right now. But I actually have been doing some reporting on the childcare crisis for a number of months, and a lot of the people in the space that I talk to keep coming back to the low pay
Yeah.
for providers. And many of them who work on behalf of providers are also wondering about $90 million that's been sitting in the CCDBG fund. Is that being used to offset any of that?
I'm sure it is. So one of the things too, you start with that, and then I just lost my train of thought. The funding piece, right?
Yeah.
Okay.
So there have been the governor's made significant rate investments, Aaron, in rates, which really do go to those frontline wages. And that bucket of money that you see, it covers the cost, and we're always looking forward, right? We project out fairly far to make sure that we have our costs covered. But we are constantly reevaluating those rates. That's a new process internal to our agency and not something the agency's had before Governor Reynolds' tenure. And that's a really significant shift because it makes sure we're constantly reevaluating. Wages are a friction area, certainly. Yes, she did. And so it is something we're constantly surveying and making sure that we're having really strong mechanisms to keep wages as high as possible while really maintaining that balance on affordability as well. However, some of the pilots that we're studying, right? Do you want to talk about the pilot?
Well, you don't talk about the childcare.
Right. So childcare workers are categorically eligible irrespective of income. And it is a pilot, it's a demonstration, right? So we're going to measure the effect of that. Thinking about a profile of individuals, typically women, who may be willing to come and work if they had coverage for their own children. And we're seeing tremendous benefit from this pilot. We believe there may be other components in the workforce that are untapped potential there. And so as we study, we're bringing those ideas forward to the governor.
Yeah, really excited about that. And that came from a child care provider, and she was so excited when we did the demonstration project, and I think we're going to have some great data for that. The other thing that I've tried for a couple years, I don't think I got it through again last year, is I'm trying to tax child care facilities as residential and not commercial. So anytime I can bring down their cost, then they can take those savings and actually put them into the workforce. And they want to. I mean, you know, they're there to serve kids and families. That's what they want to do, and they're just looking for ways. So if I can reduce their input cost, help with some of the increase in the CCA funding that they have eligibility to receive, then that can be passed on to the workforce. And then again, getting those kids excited about it in high school and middle school, and that helps until we can build that workforce out, because every industry is struggling with workforce, and pay is a part of that across the board. But I do think we're trying a lot of different things that I think are going to prove beneficial and will help get us where we need to go. So, excited about that.
In terms of the data, I've known a lot of women who went back to work after their first child was born, and then once they had a second child, or especially a third, it just didn't pay. They weren't earning enough. They would basically be going to work just to pay the cost of 2 kids in childcare. I'm just wondering what data the state has. Is there any data supporting that idea that it's just the cost of, particularly if you have more than one child in childcare, that
Those
people
are
are just dropping out of the workforce for that reason?
Those are individual family decisions, really. My daughters, I have 2 daughters that are a great example of that. We have, our oldest one have 4 children, and they worked outside of the home. And then when they were expecting their 3rd one, you start penciling your budget like all of us do. And you make a decision whether you want to stay in the workforce or if you want to stay home with the kids. And I literally told them, we need workforce, but I said, that if you can do it and make it work, then you do it. That's your decision, but that's a family decision. But, as we continue to struggle with workforce, we're going to continue to see wages rise. That's our goal. And so, but again, so hopefully we're working towards that, and we can start to show what the average wage in Iowa based on industry. We can present some growth with some data. We do that, I think, annually. We actually track that because I'm seeing what other states are doing, so I can be competitive so that our families can earn a decent wage and be able to take care of themselves. The inflationary costs that we're experiencing right now is just attacking that. When you're spending like a drunken sailor and you're shutting down homemade energy and you've got an open border, cost of living is tough right now. People can't afford a home, they can't afford food, they can't afford to put gas in their car, but that's because of a lot of decisions that are being made out in Washington, D.C. So that's a pressure point that I believe needs to be eliminated that would help these families succeed and be able to take care and feed their family and maybe go on a vacation or do some other things that families like to do.
But does the state have data on how many people are leaving the workforce specifically after having a second or third child?
We somewhat, but
Yeah. So we actually have been doing a significant amount of work internally, and this is really respective to the individuals that we support through child care assistance. So we do a lot of, governor's made incredible investments in what we refer to as the cliff, right? We have a program called CCA Plus that covers a higher level of wages for that very reason, Laura. And we're doing some deeper analysis across all of our benefit programs to really identify where do we have disincentives, where those decisions are being made. Obviously, we're not talking about all Iowans there, right? But we're talking about the Iowans that are supported through our social and economic and medical assistance benefits. But that's a really important sector that rely on childcare, and maybe a typical profile would be a single woman with kids. And so we're really thinking about how to harness that energy and make that successful so that we can get out of this merry-go-round of cyclical benefits and instead really achieve economic mobility.
and training as well
Absolutely.
to help them get the skills to even get a better job. So we're doing a lot with workforce to just, all across the board. We're willing to step in and help them get a better job that can support them.
So
But
would
thank
it
you
be-
for that.
After everything you said here, would it be fair to say that kind of your initial broader efforts would be lowering costs for providers, helping them in theory bump up wages, and then from the data you may learn about, I guess I'm not seeing where the cost reductions for families would be part of this. Is that something you hope to kind of figure out later? I know they raised the
Well, just balancing the cost of daycare and then the
Yeah.
cost of providing it. That's just something that we're going to continue to work through. It's been an ongoing, like I said, I brought it up. That is the issue that we continue to struggle with. And we're trying to approach it from a lot of different perspectives, a lot of different programs. But we're continuing to look at that and see what's available. We're trying to, see if we can come up with some new ideas like the demonstration fund or demonstration project that allows child care providers to let their staff who come there to work actually have free daycare. You know, Kelly's team put that together based on a recommendation from a child care provider. You know, so those are the we get a lot of feedback from the providers. I spend a lot of time out in the state saying what's working, what's not. I had a child care provider come up to me at the state fair and just say, thank you for what you did during COVID, or I'm telling you, I wouldn't be in business today if you hadn't provided those resources that got me through a really, really tough time. And, you know, I mean, that was COVID related, you know, and that was this state fair. So we spend a lot of time asking and just trying to figure out when we start to see a consistent theme, then what are we missing? You know, what can we do to address it?
Details on how much it costs to build out the site?
I don't know that, okay.
So with all of the data integration that has taken place in the years of work, the initial investment has been about $5.2 million. And then we have, of course, our ongoing maintenance of effort that will have around $500,000 a year or so projected over the next couple of years.
And correct me if I'm wrong, you did get some federal child care assistance funding that you were able to utilize for that, I think, right?
Yes, so the initial investment was through our American Rescue Plan Act, CCDF discretionary funding.
Okay, thank you.
About 3 years ago, we were in this room and Council Bluffs, the school district,
Uh-huh.
on $7 million
Yeah.
for an early. Is that part of the solution?
Yeah.
Is to locate these at school districts? And I don't know that we've gotten the report after, I think it was supposed to open last school year.
No, it's open, it's doing great, and, you know, Vicki, who's a superintendent, she really figured out a way, braiding all the different funding to really sustain what they put in place going forward. And then the Director of Education did a kind of another grant program to encourage other school districts to take a look if they could implement something similar. Dubuque Bright Minds, is that the name of it? In Dubuque is another phenomenal example of city, county, the Y, child care, all coming together. John Deere, several businesses in the community are not only help put the facility together, but they've also worked in partnership with the state too. There was some grant funding for that to really figure out how they could enhance the wages over 3 years. So they were doing like a supplemental wage increase, and then for like 3 years, I think, with all of that braided funding coming in to support it, and then in the interim, continue to look for ways that they could sustain that going forward. So there's just a lot of really innovative, collaborative ideas that are taking place, and so we hope to continue to build that out. I point to both of those, and I know a lot of school districts, a lot of superintendents have spent time in both facilities taking a look at what they're doing to see if they could implement that in their communities.